Hey everyone, my name's Natalie. I'm a first year OTD student and welcome to the Student Conclave. A little bit about today, we're going to have panelists and separate sort of sessions where we're going to hear about different discipline areas and different fields and different practices. So stay tuned, we'll tell you all about it. We're going to have other students kind of give you a little bit about what they learned in each of their sessions. Thanks for joining us and let me know if you have any questions.
The AIU is school-based OT. I work in a variety of schools, from primary school through high school, kindergarten, 12th grade. A typical day for me. Some days I'm doing treatments all day, primarily in the schools. Other days, my day is spent with evaluations, reevaluations.
Nursing facility in Murraysville called Murraysville Rehab and Wellness Center. So for my day, as in the position I'm in as a manager, I would treat patients approximately 30 to 40% of my day that I'm there in the building. I may do an evaluation or two and perhaps a treatment or two, but the majority of my time spent is managing the insurance authorizations and the minutes that the patients are being treated, and a lot of meetings with family members just to educate the family. As the therapist's typical day, they see an average of 7 to 8, sometimes 9 patients a day. The average treatment runs from 30 minutes to sometimes 60 or 70 minutes. They do a lot of visits where they can go to the patient's home with a family member to help prep for
constant changing, and having requests come in from case managers and doctors and nurses, and to manage your time effectively.
Kids, sometimes the first time they do something, it's pretty powerful, and you don't get it with every patient. So usually you get that one kid every 5 to 6 months that gets you over the hump. It's not like every kid you're going to see is going to be great and get better. So that's hard when you come out of school because you expect help at everybody. And not everyone just moves on that straight progression. But you get that one kid who really does everything, and that pushes you over the edge. So what got me into my practice area, I did study work when I was a student at the Children's Institute. And then my fieldworks helped me to really outline pediatrics was really the path that I wanted to go. So looking at where you guys are going, use your fieldworks wisely in terms of setting up what you might want to do or might not want to do.
And it's kind of like firsts all over again. Like you're the first person that's kind of signaling that they're getting better. The first person that they're getting out of bed, and so it makes them, well, it doesn't always make them feel better. I mean, they're like Lynn said, they don't always want to see you, and it's not going to be with every person, like he said. But at the same time, those moments, especially the family, they see you walk in, you say you're from physical therapy, occupational therapy, speech therapy, they're like, yes, this means you're getting better.
Hi, I'm Danny. I'm a first year OT student. We just had a breakout session with some school-based pediatric OTs. They work for the Allegheny Intermediate Unit, so pretty much the school district is their clients. They work from the top down, district, the school, the classroom, groups, individual, and pretty much they're just helping these kids better access their education, what kind of interventions or assistive technology or anything that we can do to help them have a better experience in school.
Hi, I'm Emily. I'm a first year OTD student here at the University of Pittsburgh. I was just talking to Holly Stantz, who is a low vision specialist, which is something I'm really interested in. I think it's fascinating that people aren't able to see, but they're still able to be independent in their everyday activities.
Hi, this is Jason. I'm the president of UPSO. We just finished our last panel, and I gotta say it was an excellent time. I'm surrounded by a bunch of other people. We learned a lot, right, everyone? Yeah, we learned a lot. We met a lot of very cool people, and I feel like I know so much more than I did when I first walked in here.